CEN Test Prep Exam IELTS. Question 1. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A. Confront the colleague directly. Option B. Report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. Question 2. Which ECG finding is most indicative of hyperkalemia? Option A. Prolonged QT interval. Option B. Peak T waves. Option C. ST depression. Option D. Delta waves. The correct answer is option B. Peak T waves. Question 3. In distributive shock, the primary pathophysiology is option A. Pump failure. Option B. Widespread vasodilation and increased capillary permeability. Option C. Fluid volume loss. Option D. Obstruction of blood flow. The correct answer is option B. Widespread vasodilation and increased capillary permeability. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be option A. Elevated PaCO2. Option B. Low PaO2, hypoxic drive. Option C. Increased pH. Option D. Elevated HCO3. The correct answer is option B. Low PaO2, hypoxic drive. Question 5. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Question 6. Which assessment finding is consistent with a flail chest? Option A. Crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. Tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Question 7. A patient with suspected bowel perforation should have which initial diagnostic study? Option A. CT scan with contrast. Option B. Abdominal ultrasound. Option C. Upright chest X-ray. Option D. Colonoscopy. The correct answer is option C. Upright chest X-ray. Question 8. The most common cause of airway obstruction in an unconscious patient is option A. Laryngospasm. Option B. Foreign body aspiration. Option C. The tongue. Option D. Mucosal edema. The correct answer is option C. The tongue. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A. A ventricular septal rupture. Option B. Papillary muscle rupture with mitral regurgitation. Option C. Pericarditis. Option D. Aortic dissection. The correct answer is option B. Papillary muscle rupture with mitral regurgitation. Question 10. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A. The ETCO2 of 0 mmHg. Option B. Persistent ETCO2 waveform with each ventilation. Option C. PTCO2 of 50 mmHg. Option D. A flat line waveform. The correct answer is option B. Persistent ETCO2 waveform with each ventilation. Question 11. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 12. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, a dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Question 13. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as option A, TSI level 1, option B, TSI level 2, option C, TSI level 3, option D, TSI level 4. The correct answer is option A, ESI level 1. Question 14. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours, option B, 4-6 hours, option C, 2-3 days, option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 15. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid, option B, a vitamin B12, option C, thiamine, option D, magnesium sulfate. The correct answer is option C, thiamine. Question 16. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 17. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or Td booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or Td booster. Question 18. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI. Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The most critical treatment for a patient with heat stroke is option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Option C, the administration of antipyretics. Option D, active external revarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius 102 degrees Fahrenheit. Question 20. Hepatitis A is primarily transmitted via option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, a contaminated needles. The correct answer is option B, fecal-oral route. Question 21. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain. Option B, a damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 22. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Question 23. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 24. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 25. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass.